Assalamu alaikum students. Today the topic of our discussion is local control of blood flow by tissues. This is the first lecture regarding local control of blood flow by tissues, and this is the start of fourth chapter of circulation from Guyton. So let's start. First, you should know about the word local. What is meant by local? Local means actually the organ, a specific organ. Either it is a brain, it is a muscle, it is a heart, kidney. So in a specified organ, when we discuss about blood flow in a specified organ, this means local blood flow. These are our learning outcomes. Local control of blood flow in response to tissue demand. Mechanism of blood flow. Acute control of local blood flow. Reactive and active hyperemia. Autoregulation of blood flow. Special mechanisms for acute blood flow, relaxing and constricting factors controlling tissue blood flow, and long-term local blood flow. So the local blood flow is mainly of two types: acute control of local blood flow and long-term local blood flow. So the regulation of local blood flow is of two types: acute and long-term. In the coming slides we will discuss these points one by one, and we will cover these topics in 2 lectures. So this is the first lecture. So first of all, local control of blood flow in response to tissue needs. So the tissue needs is very important. The local blood flow depends on tissue need. Tissue need means that the metabolic need of the tissues, the activity of the tissue. The resting tissue needs little blood flow, and the active tissue needs more blood flow. So all centered around, the story centered around the metabolic need. So the need of the tissue. Ability of each tissue to control its own local blood flow in proportion to its metabolic needs. What are the metabolic needs? Oxygen, nutrients, glucose, amino acid, fatty acids, removal of carbon dioxide, removal of hydrogen ions, maintenance of proper concentration of other ions, transport of hormones, plus other substances to tissues. So these are the metabolic activities which occur in the tissue. And if these activities are more, the blood flow is more. The function of skin is control of temperature. Kidney function are excretion of waste. The function of kidney is excretion of waste. Some tissues have extreme degree of local blood flow because there is extreme degree of metabolism there. These are the few examples of tissues, of organs, and their how much blood flow towards that tissue. It is given in percent as well as in milliliter per minute and milliliter per minute per 100 gram. You can see only the percentage. From a percentage you can realize that liver has a blood flow of 27% out of total 100%. So the major share goes to liver, and then kidneys 22%, and then brain 14%. So that these 3 organs have a major share of blood flow. And you can see here the thyroid gland, 1%. It is very small in size and has a very large amount of blood flow, because it has a great amount of metabolic activity. It controls the basal metabolic rate of the body. So it is a very important gland. Importance of blood flow by the local tissue. Blood flow to each tissue usually is regulated at the minimum level that will supply the tissue requirement, no more, no less. The workload on the heart is kept at minimum level. So the supply to the tissue, the blood supply to the tissue is accurately according to the tissue requirement. It is neither too much or neither too less to the tissue. It is at that level that the tissue requires. So thus the workload on the heart is kept at minimum value. So there is no effect on the workload on the heart. And mechanism of blood flow control. Local blood flow control divided into acute control and long-term control, as I have told you. By rapid changes in local vasodilation or vasoconstriction of arterioles, meta-arterioles, precapillary sphincters in seconds to minutes is the acute control. In acute control, there occurs vasodilation or vasoconstriction of different parts of the vessel system in seconds to minutes. And the long-term control is slow. Control changes in flow over a period of days, weeks, or months. So it long time to take the control. Long-term control is due to increase or decrease in size or number of actual blood vessels supply the tissues. In this process, there occurs the process of new vessel formation, that is called neoangiogenesis. So the number of vessels become increase, so that the blood flow to the tissue is increased. And this the stimulus, the main stimulus for this neoangiogenesis is the lack of oxygen. When there is ischemia, there occurs neoangiogenesis. Acute control of local blood flow, effect of tissue metabolism in local blood flow. When there is increased metabolism, increased blood flow, as I have told you in the previous slides. And effect of oxygen availability in local blood flow, that is very important. Whenever availability of oxygen is less, blood flow is more, because the less oxygen causes vasodilation. So be remember that when oxygen is decreased, there is vasodilation and there is increased blood flow. And when oxygen is decreased, when the person is at high altitude, when suffers from pneumonia, or may encounter carbon monoxide poisoning or cyanide poisoning, the basic theories for regulation of local blood flow, when either rate of tissue metabolism changes or availability of oxygen changes. So the acute blood flow depends on two things. Number one is metabolism and other is availability of oxygen. With the metabolism, the blood flow has a direct correlation, and with the availability of oxygen, blood flow has inverse correlation, inverse relationship. Okay. What about the vasodilator theory for acute local blood flow regulation? Role of adenosine. Some vasodilators formed and released act on precapillary sphincters, meta-arterioles, or arterioles whenever. There is a release of vasodilator substances. One is the example is adenosine. This adenosine causes vasodilation of precapillary sphincters, meta-arterioles, or arterioles whenever there is a greater role of tissue metabolism, less availability of oxygen, or less availability of nutrients. Then there is vasodilation. So when these three things occur in the tissue, either there is greater metabolism, there is lack of oxygen, there is lack of nutrients. So in the tissue needs more oxygen because there is less availability of oxygen in the tissue and the less availability of nutrients, but the tissue needs more oxygen and nutrients. So there should be more blood flow towards tissue, and for more blood flow towards tissue there should be vasodilation, and so there is action of vasodilator substances like adenosine. And the other example of vasodilator substances include carbon dioxide, adenosine, histamine, potassium ions, H+ ions. Most of vasodilator substances are released from the tissue whenever O2 deficiency. Okay, it's very simple. I have told you that when there is oxygen deficiency, there is more blood flow, there is more vasodilation. So when oxygen is less, then carbon dioxide is more, because these two are to have inverse relationship. So the carbon dioxide is a vasodilator substance while oxygen is a vasoconstrictor substance. So this is our first part of local control of blood flow to the tissues.